whānau, welcome back to another Women's Health Action Trust Digi Update. I'm Caitlin, our Digital Media Health Promotion Coordinator. For today's video, I'm going to be touching on some of the updates to the health and disability sector under Level 2. So there's been a few updates with moving through the levels and a little bit of the restrictions lifting, and the government's put out a pamphlet which touches on these. It's quite a long pamphlet, and I'm imagining with Level 2 a few of us are starting to have busier schedules again and perhaps might not have time. So I'm going to do like what I've done in previous videos, read it out so you can feel free to listen. So the things covered under this video are hospitals, primary care services, so like your GP, disability services, aged care providers, and mental health and addiction support services. So I'll just read out all of the information on how those are operating under Level 2. If you're pregnant or you want to know more about maternity services, I've made its own video on that, and it was the one previous to this one, so feel free to check that out. Just scroll down on our Facebook page. Key things to know. Services will operate normally where possible while managing public health risks. Strict hygiene measures and physical distancing measures will remain in place. Infection prevention and control principles must be adhered to across the system, and testing for COVID-19 is going to continue at community-based assessment centres, designated practices, and some general practices. Hospital. The government's COVID-19 alert levels and the National Hospital Framework alert levels serve different purposes. Regardless of the country's alert level, DHBs operate services aligned with the National Hospital Response Framework, which enables them to safely deliver as much clinical care and surgery as possible and respond swiftly and appropriately to COVID-19. Hospitals are open for the acute and emergency health needs of the population at all levels. The National Hospital Response Framework includes guidance about making decisions to defer non-urgent treatment or to changing service models to online or telephone. Such decisions must consider equity and the clinical risk associated with the delay or change to a treatment, and take such steps to mitigate harm or deterioration. For example, it's recommended DHBs review the waiting list for planned care regularly to ensure the highest priority needs are dealt with first. Planned care services, traditionally known as electives, encompass medical and surgical care for people who don't need to be treated right away. Planned care, including elective surgery and radiology, will be provided in order of clinical priority. Depending on the demand for hospital services, including as a result of both COVID-19 and other non-COVID-19 conditions and needs, some non-urgent services or treatments may be deferred. Outpatient appointments will continue dependent on demand via telephone, online or contactless methods as much as possible. As New Zealand deals with COVID-19, there needs to be changes to visiting hospital to protect staff, people and patients. The National Hospital Framework and Clinical Visitors Policy describes changes to visiting DHBs under the National Hospital Response Framework. The number of visitors allowed per day per patient depends on where they are, and discretion may be applied on a case-by-case basis. People are encouraged to check with the DHB before visiting hospital to make sure they'll be allowed. Visitors must take place during usual visiting hours unless there is a prior arrangement with the ward. When visiting relatives in hospital, people need to follow precautions such as good hand hygiene and physical distancing. The hospital will record visitors' details in case contact tracing is necessary. Visitors should be aware that they will be asked screening questions and may be refused entry to ensure patient, staff and public safety. Now, the hospital alert system is Hospital COVID-19 Orange and the Hospital COVID-19 Green or Yellow Alert. Under the Orange alert level, a maximum of one visitor at a time may visit a patient at the hospital or clinic. No non-essential visitors. For higher risk areas such as the ED intensive care unit, NICU, SCBU or maternity, a maximum of one visitor at a time is allowed and only one visit per day. Under green or yellow, there is a maximum of 2 visitors at any one time that can visit a patient at a hospital or clinic. For higher risk areas, a maximum of 1 visitor at a time will be allowed and only 1 visitor per day. Primary and community health services. All primary and community healthcare services will operate if appropriate COVID-19 risk screening is in place, such as an assessment of symptoms, travel and contact with people with COVID-19 to ensure they pose no risk to staff or other patients, and public health protection measures are used, including infection prevention control, physical distancing measures, and appropriate use of personal protective equipment. General practices. General practices are open at Alert Level 2 and may look to work with patients who have had hospital or specialist activities cancelled or postponed during Alert Levels 3 or 4. Appointments should be conducted online by telephone where possible, with face-to-face consultations made available if required. All usual primary care continues. This includes screening, acute care, long-term condition support, preventative services, antenatal and newborn care, and routine health needs, including mental health consults, prescription of contraception, and other medication. The referral of patients to secondary or tertiary care according to clinical need and the status of the hospital sector will also resume. Essential preventative care will continue, including influenza vaccinations and primary care administered childhood immunisations. Community health services. Pharmacies are open under Alert Level 2. Person-to-person medicine services will resume at Alert Level 2, such as medicine use reviews and long-term condition support. Some services will use online/telephone with people, with in-person services available for people who do not have reliable access to technology and the internet. There will be an increase in the over-the-counter sales of pharmacy-only medications and an increase in non-essential pharmacy sales. For at-risk people, it is still encouraged to use delivery services to get medications. Midwifery appointments will be provided through a variety of methods, which include face-to-face and virtual appointments. At-risk people will receive scheduled face-to-face appointments. Antenatal and newborn screening programs will continue. Community dental services open as normal under Alert Level 2. Routine, urgent and emergency care may be provided for patients who aren't confirmed or probable cases of COVID-19, close contacts of confirmed or probable cases of COVID-19, and people waiting for test results. Confirmed or probable cases of COVID-19 or people awaiting test results can receive emergency and urgent dental treatment with clinicians meeting PPE and room requirements. Telephone screening will be used to assign a patient's risk category. Scheduling of those with certain medications or those over 70 must be carefully managed. Guidelines for oral health services can be found online. Community allied health professions like physiotherapy, podiatry, optometry, and Well Child Tamariki order providers can operate normal after an appropriate COVID-19 risk screen has been conducted, taking into account public health precautions where necessary and appropriate. Virtual appointments are still encouraged where possible. Māori and community health providers. Māori and community health providers are open at Alert Level 2. They can operate as normal after an appropriate COVID-19 risk screen has been conducted, taking into account appropriate public health precautions where necessary and appropriate. Virtual appointments are encouraged where possible. Providers contracted to do so will continue to use community-based and mobile COVID-19 testing in their communities. Disability and aged care services. Disability residential care. Disability residential care continues to operate with Alert Level 2 public health control measures in place. Extra consideration will be given to how the health of at-risk residents will be protected. Moves for residents between residential facilities are allowed. Community participation services such as sports and activities can continue in a safe way using physical distancing, limits on the number of people gathering, hand hygiene, and other measures. Disability residential care visiting policy. Visits with agreed and named family and whānau and close family and friends are allowed, but all residents are to be recorded to aid with contact tracing, and visitors with known COVID-19 contact or respiratory symptoms are not granted access. This is an important mechanism to ensure people's well-being and safety will be managed by the provider. For disabled people at risk of severe illness from COVID-19, it must be agreed between disabled people, residents, families and providers who should visit and how each resident's health will be protected. All essential visitors, such as essential carers and tradespeople, must follow Level 2 precautions. All essential visitors, such as essential carers and tradespeople, must follow Alert Level 2 precautions. General visits are allowed at Alert Level 2, but there are restrictions on the number of friends or family members visiting and the frequency of these visits. No non-essential visitors are allowed at Alert Level 2. Moves for residents between residential facilities are allowed, but must be supported with contact tracing, physical distancing and hygiene practices. For disabled people at risk of severe illness, additional precautions should be undertaken to limit the risk of those people contracting COVID-19. Aged residential care. Aged residential care facilities operate at their full scope with Alert Level 2 public health control measures, and planned respite and urgent respite care will be available. A COVID-19 risk assessment must be undertaken before admission of residents, including respite clients and existing residents returning from hospital. PPE guidance is to be followed. At Alert Level 2, visiting will be allowed, including general family visits and non-essential service visits. However, providers will take precautions and manage visiting in a controlled way to minimise the risk of COVID-19 transmission to residents and staff. Measures for managing visits will include limiting designated visitors. There may be a limit on the number of designated visitors at one time by appointment and sign-in process. Check with the provider directly prior to organising a visit. Links of visits and visiting areas may be limited. Health screenings such as an assessment of symptoms may be completed, and visitors must follow Ministry of Health and facility infection prevention and control measures, for example hand hygiene, physical distancing and an appropriate use of PPE. Home-based support. Home-based essential personal care services, e.g. toileting, washing, feeding, should be provided under Alert Level 2. Infection prevention and control measures must be adhered to for essential care services that require close physical contact. Staff movement should be minimised between homes, and household management activities should maintain physical distancing where possible. Urgent in-home equipment will be provided where needed. There should be an agreement between home-based support clients, disabled people, other chronically unwell people or older people, family and whānau, and providers on who should visit clients and how their health will be protected. Mental health and addiction services. Mental health and addiction inpatient and residential services will operate at Alert Level 2. Services should operate at normal capacity wherever possible. Overall bed capacity may be reduced to enable good infection prevention and control measures or to enable consolidation of clinical staff. Some inpatients may be considered high risk and therefore may have additional steps taken to reduce movement within/outside the facility. Inpatient units must have separate COVID-19 positive/suspected and non-COVID-19 areas for patient care, with no staff crossover between these areas. Any inpatient trips will be postponed where they do not meet restrictions on travel/gatherings for Alert Level 2. The visiting policy as per the intent of the general guidance for hospitals during Level 2, with accompanying physical distancing and infection prevention and control protocols. Where visitors are permitted, inpatient services must record visitors to ensure contact tracing can be conducted if necessary. Record keeping must capture the following personal details: full name, date, time, location, attendee/client phone number, and physical address. This information needs to be rapidly accessible by health authorities should it be required and kept for up to 2 months. Inpatient units must have ability to manage COVID-19 positive and suspected cases separately. Community mental health services continue to use virtual/telephone appointments where possible. Face-to-face appointments may be provided so long as the health professionals and support staff can take appropriate measures to manage public health risks as per ministry guidance. Urgent/crisis services will operate as usual with appropriate measures to manage public health risks as per ministry guidance for Alert Level 2. So those are the updated guidelines for health and disability care under Alert Level 2. You can see things are starting to go back to normal, but very slowly, and kind of under that term of playing it safe and making sure we have proper physical distancing still where we can, and also frequent hand washing and hygiene measures. Hopefully this video was helpful. We'll keep you posted as these are updated, and in the meantime we hope you stay well and we will talk to you again soon. Bye.